Let's start with another high yield USMLE concept. So there is a patient, 32 years old female, who is presenting with abdominal bruit plus hypertension. BP is pretty much high. So what would be the direction of arrows, that is downward arrow, no change, or an upward arrow to the following parameters? Number one, sodium. Number two, potassium. Number three, pH. Number four, bicarb. And the last one, carbon dioxide. So first of all, we have to diagnose this patient. What is the likely etiology in this patient? So this patient is suffering from fibromuscular dysplasia. So you see that this patient is having an age of 32 years. And this 32 years old lady who is having a hypertension, BP of 160 by 100, plus abdominal bruit. It means the patient is having a stenosis of the renal artery, but this stenosis is because of the fibromuscular dysplasia. And this, like if the patient is having a young age and the patient is having female gender, so you must think of fibromuscular dysplasia as an etiology. But if the patient is having an older age, like the patient is having an age of 60s, 70s, and the patient is having hypertension, patient is smoker, or patient is having a history of previous coronary artery bypass graft or previous history of stroke or heart attack. So you must think of renal artery stenosis because of the atherosclerosis of the renal artery. So atherosclerosis of the renal artery can cause the renal artery stenosis. But in this case, this is a young lady with no history of coronary artery disease, stroke, or previous cabbage. So you can think of fibromuscular dysplasia as an etiology. In fibromuscular dysplasia is basically the hyperproliferation of the smooth muscles of the wall of the vessel. So it causes the hyperproliferation, and this hyperproliferation result in the decreased lumen or decreased caliber of the renal artery. And this decreased lumen or decreased caliber of the renal artery results in the decreased blood supply to the kidney. And when the renal blood supply compromises, so it results in the activation of the renin angiotensin system. And as the renin angiotensin system kicks in, it results in the activation of aldosterone. And what is the function of aldosterone? Aldosterone is going to cause the increased absorption of the sodium. So there would be an upward arrow for sodium, and there would be an downward arrow for potassium, because aldosterone causes the excretion of the potassium. So you would be having a downward arrow for potassium and upward arrow for sodium. Similarly, uh, aldosterone causes the excretion of the hydrogen ion. It excretes the hydrogen ion. So when you excrete the hydrogen ion, it means you're going to lose the acid. If you're losing the acid, it means your pH is going to increase, and your bicarb is also going to increase. And what about carbon dioxide? Because the body is having in the state of alkalosis, right? You are losing the acid, and you are retaining the bicarbs. So in order to compensate, there is respiratory compensation by decreasing the respiratory rate. So you do not blow off the carbon dioxide, and this results in the increased retention or increased serum concentration of the carbon dioxide. So you can see that direction of the arrow, an upward arrow for the sodium, and downward arrow for the potassium, an upward arrow for pH, an upward arrow for bicarb, and also an upward arrow for carbon dioxide. So this was all about fibromuscular dysplasia.